And what I'm going to do to give us a starting point is conceptualize or define what I mean by healthy or successful aging, using a pretty classic model thereof. So we have some way of thinking about what purpose may be doing to help individuals across the lifespan. And as you'll see, this talk really takes a perspective that aging is obviously a lifelong process and not just something focused on older adults, even though a lot of what I'll be discussing is from kind of a gerontological perspective. So then we've talked a lot about what having a sense of purpose means, so I'll briefly fly through that and start linking it to markers of successful aging. And at least throw out a few ideas of potential mechanisms involved in the process, more as a starting point for our discussions of some of the things that we've been finding throughout the years that might help us to answer some of the questions last night of why is purpose having all these benefits that Carol brought up. So to begin, a number of you may be familiar with a pretty classic model of successful aging that was first produced, I guess, about 30 years ago now, in which Rowe and Kahn were really focused on trying to take aging beyond just the biomedical model. So not just thinking about the aging process as the absence of negatives or this kind of continuing decline in health-related outcomes, but seeing it as more than just a distinction between pathological and non-pathological aging. And you'll see pretty quickly why I think this model is rather relevant for us today. It's not showing up. Oh, well. Okay, so I'll tell you what's showing up here. So up at the top, we have just the part you can't see is this notion of incidents and issues with the health, health declines, your risk for ailments over time. And Rowe and Kahn mentioned that you have to go beyond just that incidence of health to understand that successful aging comes at the confluence of reduced declines as well as promoting high cognitive and physical functioning and even engagement with life. So, not surprisingly to most of you in the audience, it's this last piece where purpose in life really fits in. That if individuals are successfully engaging with their life, that probably means they're leading a more purpose-driven, more purposeful lifestyle. And of course, I'm not the first to have said this, that in fact, Michael Shire and colleagues have a rather nice measure of sense of purpose that specifically is named the life engagement test, in which they define purpose as the extent to which a person engages in those activities that are personally valued. And a number of people in the room have said the same thing over the years. For instance, in their excellent review, McKnight and Kasdan mention purpose. Having a purpose involves organizing and stimulating one's goals, managing one's behaviors, and as Carol brought up last night, it entails this notion of intention, sense of direction, and having goals. So if we think about purpose in life as this component of life engagement, we can see why it might fit in well with models of healthy aging. And we do have some empirical evidence for this from a paper Kendall and I did now 7 years ago, in which we asked individuals to report on their levels of purpose in life and how agentic they felt in their day-to-day lives. And you see pretty strong correlations between adolescents, emerging adults, and individuals in their 30s, 40s, and older with respect to a sense of purpose and a sense of agency. And in fact, this is all unfortunately cross-sectional, but we find agency seems to be a big explanation for why individuals who have a sense of purpose are living more satisfied lives. And it's worth noting, this still remains to this point by far the most cited paper that I've ever done, and It's in part because Kendall and I are a bunch of narcissists that self-cite ourselves over and over and over again. But I think the other part of it is due to the fact that this really captures something essential to the idea of living a purposeful life. It is this agency component and this engagement with life, which will follow through. Oh, my one animation. You could just move this up. This is as exciting as my PowerPoint ever gets. So that's where we're going to go, and we'll talk about engagement with life as a predictor of first, avoiding disease and disability. So trying to link it as kind of the driver of the other elements of this model that Rowe and Kahn have come up with. And Carol brought this paper up briefly last night. First, a lot of our work comes from the MIDAS data set, which I think we're all pretty familiar with by now, as well as the health and retirement study, which I know a few people this afternoon will be speaking about as well. And what's great about these data sets is we not only have multiple waves of purpose data, but we also have remarkably large sample sizes and individuals kind of across an age range. So thinking about testing for age moderation, testing for whether these effects hold across different age groups. And that's what we did in the paper that was briefly alluded to last night, in which, using the MIDAS data set, my colleague Nick Turiano and I looked at participants' ratings of purpose in life at their initial time point in 95, and then whether they survived the next 14 years, as well as how long they survived if they were deceased. So we can start to think about, does purpose in life correspond to lower mortality risk, which the punchline's already been given away to some extent. But what's really interesting to me is not as much that purpose may be linked to mortality risk, but we were also able to ask, does the effect hold when controlling for other conceptual correlates of purpose? Is it purpose? Is it positive relations with others? Is it emotional well-being? And the two of us were really interested in the idea of, does the effect on mortality risk, is it dependent on age or retirement status? And to answer the first question, what you find is pretty clear evidence that purposeful people were outliving their counterparts. And I know not many people are probably used to looking at hazard ratios. It wasn't until I was working with Nick, and now we get to the very morbid issue of hoping more people die so we have greater statistical power. So hopefully none of you ever try this. But we see things, the key is whether this is kind of above or below 1. So if it's significantly above 1, it's a risk for mortality, such as, not surprisingly, older individuals, males, were more likely to die off. If it's significantly below 1, so highly educated people live longer, and in fact, purposeful people live longer. And this estimate is very similar to the recent meta-analysis that Carol mentioned last night across multiple studies now showing a pretty similar effect size. And again, this is holding up even when we control for positive relations with others, positive affect, and negative affect. Now, when it comes to the moderation by age and retirement status, we really came into this thinking there was probably going to be some moderation there. That if you consider, first off, older adults and retired individuals are at greater risk overall, so maybe there's more variability, more opportunity to pick up on effect size. And the other component, which we'll come back to towards the end of the talk, particular to retirement status, is recent meta-analysis among a number of other studies have shown that retirement is a significant negative predictor of sense of purpose, likely because you're losing those work roles that once gave you that direction and those goals. So maybe if you're losing that, purpose comes in to kind of buffer that loss and maybe provides you those new goals. So that's where we were coming from. To start with, age has absolutely no moderation effect. And there's some issues with this, how you can scale this by looking at different age groups. But to give you some idea of a visual representation, it's a pretty straight line for hazard rates across the different age groups of minus. And we've tested it multiple different ways. There are lots of ways of doing age interactions and hazard ratios, and every way seems to point to the idea that individuals who started in their 30s versus later on seem to be benefiting from a sense of purpose. And from a health psych perspective, this is really intriguing given the reasons for mortality over here differ quite a bit from the reasons that people are facing mortality risk over here. Obviously, mortality risks differ for younger versus older adults, and sense of purpose may still be buffering against all those different risks. In addition, we actually find no moderation by retirement status either. It's worth noting the MIDAS didn't initially have that many individuals who were retired to start with, but we see this in other data sets as well. And we like to joke that we're probably the only people to ever get into psych science with 2 non-significant interactions. But I think it's because those non-significant interactions are really meaningful for how we think about purpose as a predictor of health across the lifespan. So what we've done recently in this field is to follow up some of the work that Eric, Kim, and others have been doing with respect to onset of chronic conditions. So using the health and retirement sample, we have their levels of sense of purpose in 2006. And then we looked at comparing individuals who never had a chronic condition to those who developed one during the 8-year span of time. So for people who onset of a given ailment, did sense of purpose predict disease onset over the 8 years? And if so, why was that the case? And these are still somewhat preliminary findings because my great master's student is finishing up his thesis right now on it. But he was kind enough to send us some models so I can at least point to something. With respect to, we have sense of purpose here in 2006, that across the 8-year span of time, we see sense of purpose seems to have some relation to onset of hypertension, lung disease, arthritis, replicated some of the cardiovascular work with heart disease. And of the multiple mediators we played with, sleep quality was the main one that seems to be explaining these effects. That maybe individuals who have a greater, other work done by people in the room have found the same kind of thing with respect to purpose in life and better sleep, fewer sleep disturbances. And it should be noted, purpose in life in the sample correlates with things like greater exercise, it correlates with better perception that one is in control of his or her health, and none of that panned out with respect to mediation. It was really the sleep quality that seemed to be the most important factor here. So at least some initial evidence that sense of purpose is predicting or helping out with that first link of the Rowe and Kahn model. So we can then talk about high cognitive and physical functioning. I think the latter piece of this has been shown a few different ways. We just mentioned we find self-reported activity levels related to self-reported purpose in HRS. In a really nice study done recently in the Journal of Health Psychology, sense of purpose has been linked to pedometer counts. So individuals who report higher levels of purpose walk more in their day-to-day lives, which really upset us because it came right after we bought all of the Fitbits for the lab and somebody stole our idea, but it's a really nice paper. So we'll talk more about the cognitive piece, which goes back to some of the cognitive data that's been collected in the MIDAS sample. And to start with, as Carol suggested last night, sense of purpose seems to predict a reduced risk for Alzheimer's, even among those who might be susceptible due to having the pathology apparent. But following this kind of successful aging framework, we were really interested in the idea of, does it actually correlate with better normative cognitive functioning among individuals who aren't showing a deficit, or is it just reducing the risk for deficits? So we could think about, is it maintaining high cognitive functioning across different points of adulthood? And specifically, we'll see whether the associations hold. With respect to purpose and 2 measures of objective cognitive functioning, Margie Lockman and her colleagues have a great measure that's all telephone survey in MIDAS that allows you to look at objective measures of whether people can recall words immediately and over time. We have a number of executive functioning measures, including backwards digit span, a variant of the stop-go test, and so forth. So we can really get at whether purpose might be linked to better memory as well as better executive functioning. And one of the real catalysts for this comes from the review that Todd did a few years back, with the idea that they propose people who are living a purposeful life probably need to have some higher level cognitive functioning. If you are directed towards a goal, if you are focused on engaging in the ways that reflect your personally relevant values, what's important is that you have the memory capacity, you have the ability to switch between tasks, and you're probably practicing these skills more than individuals who are less purpose-driven. And what we find, so these are just the raw correlations to give you some idea. For individuals under 50 at the time that cognitive data was collected at the second wave, we find sense of purpose is related to higher levels of the overall composite, as well as higher levels of episodic memory and executive functioning. And these relationships show a slight trend to purpose being more protective for older adults, but that moderation doesn't actually pan out as of yet. So the good news is the most recent wave, which will be the second collection of this cognitive data, is in the process of being cleaned now. So we can look at longitudinal evidence soon. The one thing that we have, which I'll be presenting next month at the Gerontological Conference, is looking at individuals' longitudinal change in their perception of their memory. So using data from waves 2 and 3 of MIDAS to examine the associations between purpose and subjective memory, using items like rate your memory, as well as rate your memory compared to a year ago. And this is a particularly important variable to consider above and beyond just objective measures, because subjective memory beliefs actually correlate and predict a number of important things when it comes to the aging process. Not only does it correlate with actual memory, but it also seems to be related to better health. And my colleague here, Brennan Payne, has shown your subjective memory beliefs actually predict how well you'll gain from cognitive interventions. So people who have better perceptions that they can enact their memory capacities actually gain more from interventions over time. So what we find is, to start with, not necessarily surprisingly, people with a higher sense of purpose did report better memory skills. And you'll see this correlation of 0.3 is a bit higher than the correlation we just saw for objective memory. So there's a little bit of a potential bias there. But what's interesting is, over the 2 years of time, individuals who changed on sense of purpose, those changes predicted better self-reported memory at wave 3. So you can look at this a number of different ways, with raw change scores, residualized change scores, controlling for initial levels, and so forth. And every way we do it, individuals who increased their sense of purpose over those 2 waves also tended to report better memory abilities afterwards. So we at least have their subjective perception longitudinally that there might be increased cognitive functioning over time. So given some evidence that it may be linked to the 2 other indicators of successful aging, what we're currently working on are a few different mechanisms as to why that may be the case. And in particular, there are 4 that seem to be driving a lot of our work right now. First off, as many of the people on that side of the room will show us today and have already shown in their work, purposeful living may be related to healthy living. So we can talk about health behaviors as a potential pathway. As is somewhat implicit in the notion of the beyond the self element, we could talk about purposeful living building better relationships. And some of the other work that we've recently done focuses on whether they might build resources, in this case financial resources, for successful aging later on. And we'll talk a little bit about some of our work on purposeful individuals, perhaps leading less turbulent lives with respect to emotional profiles. So to start with, I get to call upon data from one of the few places even more beautiful than where we are now, of recent work I've been doing with the Hawaii study of personality and health. And for those of you who aren't aware of the personality and health study, this was started back in the 50s by Jack Digman, who had the great opportunity to get teachers to report on students' personality. And now they have followed up these individuals over multiple waves, the most recent wave being around age 58. So we have their teacher reports of personality when they were children. We have their health and well-being. Now we just completed the 6th wave of data collection as adults. And I was lucky enough to get them to sneak in a measure of purpose in the 7th wave of data collection. So we're just starting to play with all the different possibilities here. Some interesting things like childhood personality doesn't seem to be a strong predictor of adult levels of purpose. So it's not like certain children might be more likely to have a purpose later than others. But what I wanted to show you here today is some cross-sectional data with respect to multiple potential mediators that are all related to health behaviors. And specifically what we find is when we look at different self-reports of health behavior over time, purposeful people are flossing more, which I guess if you buy the recent data, maybe that's not that important for dental health, but we also see, again, purpose is related to higher levels of activity. Purposeful people take their vegetables more, which is a good thing. Purposeful people, again, seem to have better sleep quality. The one thing I was just dying to come out that didn't was purpose does not seem to be related to coffee intake, which really would have saved my career, but what's interesting is each of these then are actual unique mediators of the pathway between purpose and self-reported health. So it's not that purposeful people are doing any one of these things. It's that purposeful people seem to be engaged with a broader healthy lifestyle. And as was mentioned last night, there's work on purpose being related to visiting the doctor, as well as purpose being related to a number of these already up here. But the unique element of this is really that each of these may be playing a specific role. And what I should point out for anybody interested in the personality element of this model holds up when you control for adult personality using the Big Five. So purpose is having a unique effect on health and these health behaviors, even when you control for things like conscientiousness, which is a very profound, robust predictor of health and healthy behavior. And it also holds up if you want to look at the child personality as well. So the other element that we can think about is purposeful living may build healthy relationships. And one of our recent studies, in conjunction with Tony and Rachel back there, focuses on the transition from transition to college. So we know that emerging adulthood is a period of changing social relationships with one's parents. And do purposeful emerging adults actually fare better and maintain more positive relationships with their parents even during this transitory period? And we looked at this in a couple of undergraduate samples, focusing first on whether sense of purpose was related to more positive attachments to your parents. So are you reporting less anxiety, less avoidance when you're with your parents? And we do find that's the case with both mother-child relationships and father-child relationships. And again, these effects hold when controlling for the student's personality, as well as the student's time in college. So it's not the case that certain individuals may be doing better or worse in freshman year, but rather we see that sense of purpose seems to be promoting more positive attachments across these college years. And in addition, we looked at one of the more important psychoanalytic transitions during this period, being whether one functionally separates from their parents and forms their own identity. So do you have issues with the individuation process, or can you see yourself as somebody who is unique from your parents but still maintaining positive bonds with them? And again, we find sense of purpose, and this is a pretty decent association, seems to be related to fewer issues with dysfunctional individuation. So it's a clinical measure, which is why it's fewer issues rather than more positive individuation. But we do seem, again, to show above and beyond all these covariates, sense of purpose may be leading to more positive relationships with parents, even during the transition to college. And we have a lot of other data that I'm sure we'd be happy to discuss about sense of purpose and comfort with diverse others, comfort in diverse situations. But to try to fit a few more pathways in, one of the more exciting papers we've had lately is the idea that purpose may actually be linked to more positive net worth. So whether purposeful people might actually build the resources that are financially necessary to maintain the engagement with all the activities that they want to be doing throughout the lifespan. And again, we were very influenced by some of the work that Todd and others have put forth with the idea that having a sense of purpose probably influences your resource allocation. So individuals with a sense of purpose will potentially benefit both with respect to building assets that we have showed in previous work with Notre Dame samples that individuals who are more focused on their occupation might have a higher sense of purpose. That could be one mechanism by which we do some of the beyond the self elements. So you might be able to build assets more and focus on a future orientation, given a number of the studies showing purposeful people are focusing on what they need to do in the long run rather than just being more sensation-seeking in the short run. And it may affect the other side of this balance. With respect to purposeful individuals may reduce their losses because A, they have better health, so there's less expenditures going on there, and they are less risky in nature. So Tony has a recent paper in Personality and Individual Differences that speaks to this rather convincingly. So what we did was look at, again, the MIDAS sample, so whether MIDAS purpose predicts net worth concurrently and changes in net worth in individuals from -1 to -2. And to start with, I'm showing you some regression betas here, that above and beyond education, which obviously predicts net worth, above and beyond personality profiles, we have other things in here, age, everything, like the typical demographic covariates. Sense of purpose still has a significant beta weight with respect to concurrent levels of net worth. It also does for concurrent levels of income, if you just want to look at that. And it holds about the same effect over the 10-year span of time. So purposeful individuals not only have initially higher levels of net worth, but may be more likely to build their net worth over that period of time. And in my new favorite slide I ever get to present, I actually can put this in real numbers for once, that individuals who initially had 1 standard deviation higher on net worth had about $15,000 more at the initial time point and gained about $20,000 more than their counterparts over time. So it's the one time that I've ever got economists to get excited about this kind of stuff, that it seems to have a real valuable effect, pardon the pun, with respect to building assets and building resources over time. And this isn't a pathway we typically think of as promoting successful aging, but given how difficult this is to maintain financial resources during the aging process and during times of potential decline in health, this may be another factor that we need to be considering as a potential pathway. So finally, we can talk about purposeful life being less turbulent. So whether you're on this side of the bay or over on the Maverick side of the bay, is it the case that purposeful people are reporting day-to-day issues with negative affect, anxiety, and stress? And going all the way back to 2011, when Tony and I first did this developmental psych paper, we looked at adolescents over a 2-week span of time and have them complete initial levels of commitment to a purpose or identity, and then we have their daily measures of positive and negative affect over the days. So is it the case that purposeful adolescents report better emotional states from one day to the next? And to cut to the chase, what we find is even when you control for age, gender, daily levels of the other variable, as well as your sense of identity. So even controlling for one of the most important things that is discussed during adolescent development, people with a higher sense of purpose reported better fluctuations in daily positive affect and daily negative affect. And what we've done recently to follow up on this is take some of these data from the MINUS Daily Experiences study. So Nancy Sid has an excellent paper out that talks about how affective reactivity to stressors is important for understanding biomarkers of health and inflammation. And what's interesting is it's not just your positive, but also your negative. So if you're on a stressful day and you react more negatively, that's obviously seems to be a bad thing. But also if you change your positive affect a lot in response to a stressor, that can be a negative. So this data set has telephone interviews on 8 consecutive evenings, over 1,400 participants, and yeah, just mentioned that. And what we find, to start with, is if you look at the days in which people don't report a stressor, we replicate what I just showed you, that purposeful middle adults have more positive affect in their day-to-day life, they have less negative affect in their day-to-day life. And this holds up when you control for age, sex, their cognitive functioning levels, and so forth. But what's interesting is to think about the reactivity piece, particularly for understanding that turbulence component and why, if purposeful individuals are able to stay the course, that might lead to better health and well-being. And what you find is it's certainly the case that purposeful people are showing less negative affect reactivity on stressful days and slightly less positive affect reactivity on stressful days. So they're definitely better able to avoid like sweating the small stuff, if you will, and getting more anxious. These effects again hold when controlling for these variables. The one thing I'll say is this effect does attenuate when you throw the big 5 into the model. It's not the strongest effect to start with, but you do see some evidence in a couple studies, both with adolescents and midlife adults, that purposeful individuals might be less distressed or less emotionally labile in these days, particularly when they're experiencing a stressor. So to conclude, one of the reasons I wanted to start with the Rowan-Kahn model is they recently updated their discussion to include what should be done now. Like 30 years later, what are some of the translational issues we need to be thinking of? And particularly for this conference, a lot of these are going to be very relevant and important considerations for us going forward. The first is focusing on human capital, and this has already been discussed, particularly with the last talk, of what can older adults provide society given their experience. So using the aging process as a way of being generative and thinking of what we could do to help the future. And what we did on this front was a recent interview study with a retiree community up in Ottawa, Canada, in which we interviewed older adults and asked them about their purpose development and what they would tell future generations about finding a purpose. So what would you do to encourage college students to find their goals for life? And the first thing that came out is to make sure to focus on relationships, that you're not going to get anywhere without having strong people around you. So this really reflects the kind of beyond the self component quite a lot, that older adults are telling younger individuals, don't just focus on money, don't just focus on success, focus on building these positive relationships. The other element that comes up, which I find really interesting, is this kind of cautionary note that purpose may not be available to all ages. And I'm really interested to talk later with the two previous speakers, because we found a number of older adults were saying, when we would ask them about their purpose, like, that's a young person's game. Like, that no longer pertains to me, that's more for younger individuals who can do more. And it was rather telling, like something that we didn't expect to find at all. But I know when Tony and I were talking about it, Carl Pillemer has found some similar results when interviewing individuals, not necessarily about purpose, but thinking about the aging process as a whole. So the second recommendation, which resonates quite nicely with what we're all discussing, is to adopt a life course perspective. That aging obviously doesn't start in older adulthood. And one way we thought about this is asking these individuals, do they perceive continuity in their purpose over time? And even when you could take out those individuals who say, like, purpose is a young person's game, you see a lot more continuity when you ask them what their purpose was as a younger adult and a middle adult versus what their purpose is now. And the kinds of things that might be driving their sense of purpose now seem to be very related to the activities that are available to them in the retirement community and what they can do to maintain this kind of active, engaged life and focusing on what's personally valuable to them within the context of their current environment. The other thing that we've recently done, and Tony and I were joking that I think Carol alluded to it last night, and then we actually did it recently, is look at early life adversity in Midas as a predictor of later life purpose. And this paper just got published in the International Journal of Behavioral Development, showing that early life adversity, so this is a retrospective report in Midas across different categories of adversity, including SES disadvantage, abuse, health issues early in the lifespan, family structure early in the lifespan. Individuals who reported higher levels of overall adversity were more likely to report lower levels of purpose in midlife. And this shows up, it's not just a single assessment issue, but we could even take the second wave of Midas data and show the same thing. So it's not that people were just recalling early adversity and then, oh geez, I just had all that adversity, maybe I'm not as purposeful as I think I am. But in fact, you still see it as kind of a longitudinal component as well. But what's nice, to put a positive spin on this paper, is that it definitely shows that people aren't doomed by any sense. We find modest effect sizes of early life adversity on later purpose. The largest seems to be with respect to early health issues, which is something that's come up a few times. But we need to be considering even how these early life events may be shaping the trajectories of purpose for individuals in their 40s, 50s, and so forth. So the final recommendation is Rowan emphasized the need to re-engineer core institutions to focus more on successful aging rather than reducing declines. So hearkening back to the original reason they put this model forward is kind of focusing on the positive, successful element of aging. And we still may not have that in some societal institutions. So the most obvious case is to think about retirement communities again. And we've been working with the community up north to design the activities that may be more likely to promote a sense of purpose. And what's interesting is we found, this was my student's senior thesis that he's currently writing up, that in the HRS, individuals who increased a purpose also tended to increase across these different types of activities. That it wasn't necessarily any one activity that was coinciding with change of purpose. That individuals who had more cognitive activities, so doing crosswords, that kind of thing, physical activities, supporting others, as well as being socially engaged, all of these activities could be beneficial to a sense of purpose for certain people. And the other element that, coming from a health psych perspective, is rather important is thinking about how purpose might be included in medical institutions and how they might even assess a sense of purpose on intake, which comes from a recent paper, I think it was just last month or so, from Karen Matthews' group that promotes the idea of adding psychosocial assessments to intake measures, to our medical cure measures. And they suggest that these psychosocial measures really need to be based on 3 criteria. Is it value for clinical practice? So does it predict health outcomes? Is it ready? Is it reliable? Are there valid measures that exist? And can you modify participants' levels of the construct? So hopefully, I've at least convinced you of one, if not maybe the conference as a whole might help you convinced of the second. So I want to focus very briefly on the actionable component and following up on some of the longitudinal change element that Carol was mentioning last night. And specifically, what we were interested in was, can we show individual variability in their trajectories of purpose during older adulthood? So we have multiple meta-analysis and multiple studies that show purpose might decline in older adulthood, as Carol was suggesting, from cross-sectional data and some longitudinal data. But are people doomed to decline, or might there be some people who are bucking the trend? And one way we did this in a psych and aging paper was looking at individuals who were part of the normative aging study with the Veterans Affairs Clinic. So a number of these individuals were veterans in the 40s and 50s who completed the RIF measure in 2003 and again in 2006. And what you find is significant variability. And just to have something colorful, here are some of the trajectories that you see. Some people are declining much more rapidly. Some people are staying the course, and others are in fact increasing their levels of purpose over time. So there is variability and change over the 3 years, even though there is this kind of mean level decline overall that replicates everything Carol was mentioning. And what was interesting was in this sample, we didn't have much to predict that variability. We tried personality, we tried health, we tried age. It seems to be that at least from the personality side of things, there wasn't much to say why this person was going down or that person was going up. So we recently did this, a grad student working with me at WashU is looking at the health and retirement study where we now have 3 waves of data. And we can replicate the mean level decline across all working groups. So if you look overall, as well as if you look for people who are still working, retired, and so forth, individuals are declining over the 8-year span of time. But what was rather striking was there was only marginally significant evidence for individual variability. So in practical terms, this is suggesting that maybe it wasn't as actionable as we thought for older adults, that if they are all kind of declining at the same rate. But we have one caveat that it seems to be only certain groups are showing this variability and change. So to walk through what we've been doing is just plotting. This is plots of change in purpose for individuals who have never worked, retired before the first assessment, retired during the assessments, and we're still working throughout.
How do you calculate the change scores?
This is using latent growth modeling. Yep. So using latent growth modeling and controlling for measurement and variance and so forth, what we find is if this is, you might not be able to see the 0 point, that's where the declines are, that most people, all the groups have this mean below 0. We have groups like the working group, which is remarkably kurtotic, that those individuals aren't showing much variability at all in change. The one group that really is panning out here is the retired before the first wave group. That individuals in this group showed more variability in change, showed more potential to have change be malleable over time. And in fact, when we look at what predicts the retired before purpose slope, older individuals in that group were more likely to decline in purpose. educated individuals were more likely to buck the trend and potentially increase on a sense of purpose over time. And we see one effect here for people in better health were more likely to increase or buck the decline. There is one, I don't know how negative this might seem at first, but people who were married at the first time point were more likely to decline on sense of purpose. Part of that is the fact that marital status had an initial effect on the level. So married individuals are starting from a higher point. And we think, we're still playing with the data, that this might also reflect the onset of widowhood for a lot of individuals. That when married individuals lose their spouse, that might be explaining part of this decline. So that's kind of where we are at this point. That purposeful living appears to be a catalyst for successful aging for a number of different reasons, including things like health behaviors, healthy relationships with others, building resources, and being less stressed and having less turbulent lives. And I really like that recent Roe and Con follow-up for the kinds of things we need to be doing for the future to not only address how to help individuals later in the lifespan, but really taking this lifespan perspective on what needs to be done translationally throughout. So with that, I'll say thanks to our funding sources over the years, and thanks to, since nobody completes their purpose alone, all the great people I've been working with the exclusion, I mean, Tony's okay, but the rest of these people are all remarkably brilliant, and hopefully you get to meet them in the future as well. So thank you all.